So start your work and complete your work, but you should get your result and then leave. Okay, one thing is that you all have to write your practical notebooks. Should have already started. We have not asked to submit till now. Now in the practical notebooks, till now the topics are, what are the topics? Study of the compound microscope, then preparation and staining of a peripheral blood smear, and then is identification of blood cells in a stained smear, and finally differential leukocyte count. Now from the examination point of view, the topic is differential leukocyte count. See your syllabus. Just search the internet. In these days there is no problem. Just search the internet, curriculum based medical education. You will get your syllabus. It has just been revised in September 2024. So the syllabus syllabus is divided into certain competencies, certain number that you must be competent in those topics. So that name competencies. So those competencies, how many broad topics, broad headings, that means general physiology, hematology, respiratory physiology, so on, cardiovascular physiology, how many broad headings and how many total number of competencies. See that there are a certain number of certifiable competencies. We will discuss that with you, what are those things, but see the syllabus once. So topic for this hematology practical is first topic is differential leukocyte count. From the examination of point of view, that is the topic. So in that examination you won't be asked just do a smear, that is not your work. The topic will be differential leukocyte count, or approximate type for the hematology session is in the exam is 40 to 45 minutes, almost, maybe maximum 5 minutes more. So in this time you have to complete the whole work. Now for the purpose of learning, we have divided into sections. So first, for doing the counts, you have to identify the leukocytes, identify what are the different types of cells. For that you have to stain, we have to stain. So, and we have to use the microscope. So we have, for the purpose of learning, we have divided the classes into study of the compound microscope, then preparation and staining of a peripheral blood smear. Peripheral blood means what you are collecting from a peripheral blood vessel. That may be a vein or a capillary for collection purpose, never an artery obviously. And then is identification of cells, blood cells in a stained blood smear, and differential leukocyte count. These 4 topics, headings with headings, 4 dates, as you prepare practical notebooks. This is nothing new you have done in school, with index, in the index page with dates. So give the dates according to Mondays and Thursdays, starting from 4th November. Okay. And these week dates are for revision classes. So give the last 2 weeks, 4th November, then maybe 7th November, like this, Mondays and Thursdays. Avoid if there is a holiday, there was none till now. So write those topics. In what should you write? Principle, procedure in very short, calculation and results. And in the exam you don't have to write procedure also. In the exam, for the exam, it's the principle, calculation and result, that is important. And procedure, here you are doing whatever you have done, how you have done, whatever result you have got, you write that procedure, write in short. Follow your practical textbook, write in short, and never write questions and answers. This is sounding very silly, and that I have to tell you this is also sounding silly. So some people are writing questions and answers from the textbooks in the practical manual book. Practical manual will contain whatever you have done in the lab. Questions and answers are for your knowledge that you read from the book. That is not to be written in practical manual. In practical manual, each topic where principle, procedure, calculation and result as and was applicable. Obviously in staining of a blood smear you will have nothing to calculate. So they are only principle and procedure in short, and your inference. What should be the characteristics of ideal blood smear? What have you got? That your result, your inference, no calculation. Wherever there is calculation, like in differential leukocyte count, like that. So prepare your notebooks. We will ask you to submit it, and any communication to the department, faculties, to the department whatsoever, has to be done through the means of the class representative. Don't call faculties or anybody else. individually. For today, here you can take, but this is a revision class, okay? So needles, each for every topic there is one allotted class. So the rule is the needles will be supplied for you to one day. So we suggest that you keep your own needles, not only for the class, for practice at home. Take some, not like lancet needles. You may take those 23-25 gauge needles which are available, which you see with the syringes. You don't have to buy disposable syringes as of now. Just needles are available. Take those, practice at home. Keep 4 or 5 slides. Use one as a spreader slide and others as, so if you learn to prick well with one, in a single prick you can do at least 3 or 4 smears, 4-5 smears, because blood will be coming freely. Then after you have done the smear, just press your finger like this, the bleeding will stop in 2 minutes. But if you have to squeeze blood, then nothing will come. If the examiner wants, you have to do. And there will be some topics which is not possible with venous blood. That must be done with capillary blood. At least in your for your syllabus, 2 topics are there which is not possible with venous blood. That has to be done. So practice pricking. And in other topics also, in differential leukocyte count, it is possible either by venous blood or by capillary blood. But if the examiner wants, or it is written in your question, the question will be fitted here. You perform differential leukocyte count with capillary blood collected by yourself. So you have to prick and take the blood. You will not be supplied blood. How? Is this that still now you don't know how to draw the smear and you are just sitting and gossiping? You have taken the blood smear here. So then what you have to do? Draw it backwards. So do it. Keep it on the horizontal. You have to do it quickly before it. Although this is blood supplied to you. Okay, this was already anticoagulated. Okay, do it. So allow it to spread. Not like that. You have to allow it to spread along the edge of the spreader slide. Okay, still, but you shouldn't hesitate. So practice this as much time. If you do this, so this is obviously not an ideal smear. Still, it will do. Covering so little area, how can you see? How will you see the cells? Still, it will do. Practice now. Stain it. Stain it as per the procedure. Now practice it 100 times, then you will do better in the exam. At least better than what it is now. What is the use of just making one smear and waiting and gossiping? Yes, lymphocytes are usually mostly small. Large lymphocytes, in the books you are following, it is written large lymphocytes, mostly they will be small. Small lymphocytes will almost, maybe sometimes maybe somewhat smaller than the RBCs also, but in your books it is written it is larger than RBCs. Compare, first point is comparing with the size of the RBCs, but always it will not be 100% that everything will go according to books. Lymphocytes may be small. Look at the other features. 5 o'clock. Yes, good. So find some granulocytes. Granulocytes, neutrophils should be highest in number. To do the count today, this is probably the last class on this topic. Do the count. You have to count 100 cells. This is what you are doing till now is identification of cells. You have to count 100 cells and write the result. How to write the result? You have to either make a box or you have to do the. This is a grossly overstained smear. Still, it can be RBCs are not being identified. Maybe some WBCs are identified, but this is a very, very overstained. Overstained means stain dilution has not been properly followed. Don't take more stain than the amount of blood. Take stain proportionate to the amount of blood, just to cover the blood. There is no hard and fast rule that it should be 8 drops, 10 drops. Just has to cover the blood. If this blood smear has little amount of blood, then take little amount of stain. Now, too little amount of blood will not suffice for the experiment, but take the stain according to the blood present in the smear. If you squeeze blood out of your fingers, then most of it is tissue fluid. So pricking is very important. Pricking correctly, pricking your finger correctly. In the exam, you are on your own. Venous blood may not be supplied, and consider it won't be supplied. You have to do with your own blood. Keep some slides and needles for personal use and practice at home. Just the drawing the smear part. Make 2 smears every day for 10-15 days now at least. Otherwise, you won't learn. Doing one time will not suffice. In the exam hall, you will come, you can't do anything if you don't practice. Now, staining will not be possible at home, but at least prepare the smear.
Not able to focus it.
This is under which power of the microscope? 5x. Why are you doing under 5x? You may do, but no need. Start from 10x. So this is where you are focusing. Usually, this is a parfocal system of lens. If you rotate it to other lenses, the focus should not move away. But sometimes they do not work properly. So you have to focus again if you change the lens. Don't see under 5x. It is not needed.
But sir, how did you
So how did you? This is just you have to just by trial and error just try and use the course adjustment screw. So you have to take it down, take the stage down, and then bring it up towards the lens. Okay. So I am sorry, I just told the opposite. You take it away from the lens, because if you bring it towards the lens, you are seeing here the lens may touch it and break it. Okay. So keep it here and then move it away from the lens and see where it gets focused. নিজের ফিঙ্গার পিক করে করেছো? তো সেটা তো বারবার করতে হবে। বাড়িতে স্লাইড নেবে, স্লাইড রাখবে, নিজেদের নিডল রাখবে, রোজ প্র্যাকটিস করবে। পরীক্ষায় পারবে না নয়তো, অতদিন পরে গিয়ে পারবে না। এখানে ব্লাড নিচ্ছ, করে নিচ্ছ, নিজেরা নিডল রাখবে, করবে। এটা রিভিশন ক্লাস হচ্ছে। একটা ক্লাসে নিডল সাপ্লাইড হওয়ার কথা, একটা টপিক একটা ক্লাস, সেইভাবে নিডল সাপ্লাই দেওয়া হয়। কিন্তু নিজেদের নিডল রেখে বাড়িতে প্র্যাকটিস করবে। স্টেনিং না করতে পারো, স্টেনিং তো পারবে না বাড়িতে, স্টেন তো নেই নিশ্চয়ই। যেখানে থাকো, সে বাড়ি হোক হস্টেল হোক, সেখানে স্লাইড আর নিডল রেখে ব্লাড স্মিয়ার টানাটা প্র্যাকটিস করা যায়। ব্লাড স্মিয়ারটা ভালো হলেই বাকি কাজ হয়ে যাবে। স্টেনিংটা করাটা সেটা পড়ে আসবে, করতে পারবে একটা দুটো রিভিশন ক্লাস করলে। কিন্তু প্রি কিক করে যদি ব্লাড না আসে, আঙুল এইভাবে স্কুইজ করে যদি ব্লাড নিতে হয়, তাহলে কোনোদিন আসবে না রেজাল্ট। 50 বার করলে তবে গিয়ে পারবে। এই একবার দুবার করে বসে থেকে কোনো লাভ নেই। যদি টাইম থাকে আর একটা স্মিয়ার করো। পরীক্ষাতেও দুটো স্মিয়ার করবে। একটা স্মিয়ার করে যদি না আসে, তখন তুমি আধ ঘন্টা পর আবার শুরু করে করতে পারবে। যখন ব্লাড নেবে দুটো স্মিয়ার করে নেবে। প্রিক করবে, ব্লাড নেবে, দুটো স্মিয়ার করে নেবে। দুটো স্মিয়ার করে দুটোই খারাপ হবে সেটা হয়তো হবে না, একটাতে হয়তো স্টেন বেশি পড়ে গেল। এইগুলো তো কমন সেন্স। প্রফেশনাল কোর্সে কেউ বলে বলে শিখিয়ে দেবে না। মেক ইট আ হ্যাবিট টু মেক অ্যাট লিস্ট 2 স্মিয়ার্স। ক্লাসে আছো, 3 জনে 3টে স্মিয়ার করে নাও। নিডল রাখো, নিডল তো রোজ সাপ্লাই করা হয় না, একদিন একটা ক্লাস, এটা তো রিভিশন চলছে একই টপিকে। নিজেদের নিডল রাখো, স্মিয়ার করো, 3টে স্মিয়ার করো। যত বেশি প্র্যাকটিস করবে তত বেশি শিখবে। বাড়িতেও নিডল আর স্মিয়ার লিখে স্লাইড রেখে স্টেন করা প্র্যাকটিস করো। সবাই বাংলা বোঝে? কি নাম তোমার? শ্রীষিতা। ত্রিষিতা। কোথায় বাড়ি? কোথায়? দুর্গাপুর। কোথায় বাড়ি? এই বছর তোমার নাম কি? বাড়ি কোথায়? উত্তর চব্বিশ পরগনা কোথায়? আচ্ছা, রাজারহাট। মানে কলকাতা থেকে খুব দূরে নয়, রাজারহাট থেকে আর একটু ভেতরে ঢুকতে হয়। এই সবাই এই বছর এইচএস দিয়েছো 23 সালে এই বছর? তোমার ত্রিশিতা তোমার নাম, বিদীপ্তা, আর তোমার নাম কি বললে? ঠিক আছে, বাড়িতে স্লাইড রেখে, সবাই মেডিকেল স্টোর যে কোনো মেডিকেল স্টোরে পাবে, কিছু স্লাইড রাখো, নিডল রাখো, প্র্যাকটিস করো। এগুলো কেউ বলে বলে দেবে না। তুমি যদি একবার করো, যে কোনো জিনিস একবার করে কি পারবে? যে কোনো হ্যান্ডস অন জিনিস একবার করে পরীক্ষায় গিয়ে পারবে? পারবে না। কি দুবার করে পারবে? যেটুকু সম্ভব স্টেন করো। স্টেন মানে স্টেন, এই সরি স্টেন নয়, স্টেন তো বাড়িতে করতে পারবে না। স্মিয়ার ড্রয়িংটা প্র্যাকটিস করো। ভালো স্মিয়ার করতে পারলে পরীক্ষায় বাকিটা হয়ে যাবে। স্মিয়ারটা যদি না করো, তুমি বাকি প্রসিডিওর ঠিক করে দেখবেটা কি? কিছু দেখতে পারবে না।